Hi everyone, hi and welcome to this new webinar. This webinar is from Bios Stem Cells, and I want to introduce you Dr. Anna Carolina. She is the medical director of Bios Stem Cells. So welcome to this webinar.
Thank you so much for being with us this morning. And we're going to talk about the stem cells and what has been published and how does the stem cell therapy works and how you can be here to, if you want that to come to Mexico with your son, how is the procedure to come here from BIOS. And I hope that this webinar is useful for all of you. Okay, now we're going to start. And first, I want to start with what is the stem cells. Right now, there is too much information online or different newspapers and that kind of stuff of what is stem cells and how actually the stem cell work. Sometimes it's very difficult because it's too much information and not all quite right. But for to start, we're going to talk about the hematopoietic stem cell. That is a really special cell that is landed in several tissues in the fetal and embryological phases of the life. But for example, when in the bone marrow, there is a place where basically we have a specific number of stem cells, and from several years from now to now, there have been a lot of research and a lot of trials to see if we can use it in different kinds of therapy. The hematopoietic stem cells is really unique and has the ability to self-renewal. And that is very important because not all the cells can do that. And also it has the ability to differentiation in specific cell types from different tissues like endodermal or ectodermal tissues. So with this preview, about 20 years ago, there started a lot of clinical trials to see if we can use it in different diseases or different problems, and they become what is called the regenerative medicine, where they can use the stem cells to improve the quality of life of different diseases that hasn't been like a final treatment to improve the destination of the patient. And basically, with when they see all the progress and all the response with the stem cell, started using basically in neurodegenerative disease and specific in children with autism to see if they can work and improve the quality of life of these children. The hematopoietic stem cell, like I previously said, it's landed in the bone marrow, and that makes it a really special place because it has an easy access. We still have the stem cells in our bone marrow. Basically, is in all the bones of our body, and it makes it a preferred candidate for cellular therapy because of the easy access. We have to be clear that there are different sources of stem cells. There are embryological or fetal stem cells, like I previously have said, but they are still not available to do certain kind of stem cell therapy. And the adult stem cell therapy, that is the ones that are in the lower part of the slide, is what we are using here. That we have seen that they have a lot of benefits that have been worked, and it's easy to manipulate them to have a very good count to do the stem cell therapy in the regenerative medicine.
Right, and I think it's really important to say something about this. There is, as Dr. Anna said, some really adult stem cells and other kind of stem cells that are not allowed to use because have ethicals not that permission to use it. But the stem cells in the adult, we are talking about stem cells from the bone marrow, from the umbilical cord blood, from the fat of the patient. So there are different sources, but we have been seeing that the the main stem cells, or the ones that we can use and we can use in different areas and have enough stem cells, is from the bone marrow of the patient. So that is why here in BIOS we use something that we can work with, and the ethical
We don't have a problem.
and we don't have ethical problems. We don't have problems with the government or the health departments and things like that, because we already know that these are safe stem cells.
Okay, so there is really important to say that there is difference between the stem cell transplantation and the stem cell therapy. A stem cell transplantation, or it can also be called bone marrow transplantation, is that was the first studies to use stem cells as a treatment for different disease. And the transplantation implies to use it in an oncological or hematological disease, and this has been available for the patients around 1970 with the bone marrow transplantation. And the stem cell therapy, that is like a side of the bone marrow transplantation. In here, we basically, the stem cell therapy is what is called the regenerative medicine. We have been used, like Dr. Guillermo said, bone marrow or a different source of the stem cell, depend on the clinical trial or depend on how they want to obtain the stem cell. And this stem cell therapy basically has been a lot of research and a lot of information to treat them in neurodegenerative disease, also in some aesthetic procedures, and they have the ability to have an easy access. Is really easy to obtain them. It's not an invasive procedure. So basically, there are the two main difference between transplantation and stem cell therapy. We have to remember that transplantation implies medicine like chemotherapy, like a search for a donor, and the stem cell therapy, no. Basically, what we are doing here is that the patient is his own donor, is like it's called an autologous procedure, and it's not implies chemotherapy or to be admitted to a hospital or something like that, because it's a totally different procedure than a bone marrow transplantation. There have been several studies about stem cell therapy for different diseases, neurodegenerative diseases, like ELA, like Parkinson, like Alzheimer. Too many articles about these clinical trials. And for example, also there are a lot of reports to work with cerebral palsy, to work with, for example, vascular problems like diabetic foot, and specifically for autism. About the last 10 years, there have been a lot of research if they can work in the children with autism, the stem cell therapy. Right now, if we search, there are more than 1,000 clinical trials open to see it for all kinds of diseases. And for autism, there has been a lot of information and a lot of research, because it has certain, in the microenvironment, specific considerations that make the stem cell therapy a possible treatment to improve certain the quality of life and to improve certain gains in the patients. There is a lot of information that have been already published, and basically what we are trying to do is to get more information to see what is working and what is now being published and approved, and that they have already been tested and that has good results for the patients. Basically, the stem cells can be treated, like I told you before, for different situations. For central nervous system disease, like I said, cerebral palsy, I think that was one of the first things that have been working with the stem cells. Patients with a stroke, patients with a craniocephalic trauma, and after the main problem, after that the patient is totally stable, we can use that. patients with a spinal cord injury because of some kind of accident or something like that. And specifically in patients in the orthopedic area, for patients that have osteoarthritis, they have already been tested and has really, really good results. And like I told you, for patients with diabetic foot, patients with anti-aging and aesthetic procedures, patients with some kind of pulmonary problems. And basically all these diseases that are in the slide, they have been a lot of research and they have a lot of innovations to treat them, and that they have seen that the stem cell therapy is one step more than other kind of therapies.
Well, we want to talk a little bit about BIOS and what we do here. BIOS is a Mexican company that has already 10 years in working with stem cells. We first started working was as a bank of umbilical cord bank, but then we want to innovate more and want to offer more things. And the main thing that we are offering now is the stem cell therapy. We are located in Monterrey in the north of Mexico, in a really safe and nice area of Latin America. And actually it is really good here because we have all these hospitals and medical areas to be working with. Something important to talk about us, as I told you, we have different services. One of them is the biostimulation, that is the aesthetic PRP, the umbilical cord banking, the PRP, the plasma-rich plasma for any kind of injuries, for example, traumatology injuries or things like that. The bioregeneration, that is a mix of stem cells therapy and also PRP, and the stem cells therapy exactly for this kind of disease that we are talking today about. But the bone marrow hematologic stem cells autologous treatment is what we do here. And there is something important to talk about this. This is a really safe procedure that is no risk or of an infection, because we do everything in a really good environment, private facilities, clean areas, with an excellent laboratory. So we are really strict in that order to make everything really properly and do it properly good for you and for your children. Something important is that we trying to reduce the risk in any way. And one risk is the disease called graft versus host. This kind of disease usually is get it when you get a transplantation from another patient, and could be for transplantation from a donor of a different kind of tissue. But in this exactly way is when they donate umbilical cord blood or bone marrow from another patient. So when we do it at a total stem cell treatment, we reduce that risk completely. Also, we reduce the risk of an infection because we is the own patient who is donating his own bone marrow. So he is not going to infect by any kind of virus or problem or bacteria, something like that. The manipulation of the stem cells are really minimum, so the patient is not going to have any kind of problem. In other companies, they manipulate the stem cells a lot. For example, they cultivate the stem cells, or they do things like that. And we don't do that because we want to reduce the problems that this could happen. Also, we are not risking the patient to grow up a tumor because we are not injecting stem cells, from example, from a fetus or from an embryo, that could be a problem and cause a tumor in the future. Also, the procedure is really uh, can be repeated. Something is important because some patients ask us if they can come again if they saw already gains. And yes, you can come again after 6 months. And of course, making a follow-up that we do in biostem cells. And the procedure is completely ambulatory. The patient is not necessary to stay in any time in the OR or in the bios facilities. That is something really important.
And also, one thing that I want to say is that, for example, there are a lot of stem cell therapy that are using cord blood. So sometimes we don't have, as a patient or as a family, we don't have a result of the of the umbilical cord blood. So sometimes they can be candidates in a different facility because you don't have the cord blood, and you don't need this sample here in Bios because we basically we have bone marrow always, so you don't have a problem to in case that you don't have a resguard of the umbilical cord blood of your child.
Who can be candidate for these kind of stem cells? First, we always ask you to already have a diagnosis, and this diagnosis has to be one of the ones that we already said in the previous slides. Something important is no history of an oncology disease in the past 5 years. Also, there is spinal cord impairment of our HIV, hepatitis B or C, or any kind of these kind of infections. And we also run some blood tests to be sure that the patient is healthy to have these stem cells. So be sure that what we are doing here in BIOS is completely safe because we run tests to be sure that the patient is completely healthy to get the therapy. Also, the patient has to be in the best conditions. So if it's any infection or something that we see that we don't like, we prefer to postponate a little bit the stem cell therapy.
Just before we do all the tests before the stem cell therapy, and you have all the final results, the reports of that it has no infection, that everything is okay, and we already give them reports to the family.
Well, how we do it? The treatment method is first, we are going to make this test that we are talking about. So when you arrive the first day, you are going to have some blood test, and don't worry about if your child is autistic and it's a little bit difficult to hold it, or if he is not liking the needles and things like that. We have a lot of experience in this area, so our team is going to help you in all the way. So don't worry about that. We try to make everything easy for you. Also, we make the stimulation the first 3 days. The first 3 days is going to help us to get more stem cells. And the way we do it, we put a little injection in the patient's arm just to get enough stem cells for the day number 4. That is the day of the therapy. And the day of the therapy, what we do is an extraction and infusion of the stem cells. And the way that we do the extraction is in a private OR. We get there, the patient is going to be sedated, so the patient is not going to feel anything or have any pain. And then Dr. Anna is the one who is going to make the extraction of the bone marrow. The way she does is two punctures in the high level of the hip of the patient. So the patient is going to be, like you see in the slide, is going to be laid down, and she's going to make this extraction of the bone marrow. It's not necessary to make any incision or make any stitches because the patient is going to be just with 2 little punctions. And she get, with this special and sterilized and new equipment, she's going to get the enough sample of the bone marrow, depending on the weight of the patient and the age of the patient. And afterwards, that sample is going to go to our laboratory. In our laboratory, we're going to separate the stem cells from the rest of the bone marrow. The way we do it, our specialist lab team is going to separate the stem cells from the rest of the bone marrow. For example, the fat, the plasma, the red cells are going to take a part, and we're going to make like a concentration of stem cells. This concentration of stem cells is going to be applied intrathecally. So as you see in the next picture, Dr. Anna, in a second procedure, in the same day, after like 3 hours, she's going to apply these fresh stem cells. That is something really important because we apply the stem cells the same day, so the viability of the stem cells is super high. It's over than 85% of viability. So we apply it intrathecally in a lumbar puncture, and the patient gets stem cells directly to the neural system, and that is the way we use the cerebral fluid to transportate the stem cells from the lower area to the all the neural system and to get new things in the brain, and the neural system start to have changes. We are going to talk about that in a moment. And also the rest of the stem cells that could be staying in the red cells or that we already have there, we apply it through IV. So that is something really important. Here in BIOS, we don't, just discharge the stem cells. We are going to apply the stems through both ways, IV and intrathecally. And then the next day we are going to have a little follow-up just to see that the patient is fine, to see that the patient don't have any symptom, and if the patient has any symptom, we're going to give a medication and see that the patient has everything perfectly. That we are going to be available 24/7 these days, and we're going to help you in any way to have a good trip and everything.
Okay, but how does the stem cells work in children with autism? It is very important first to see that we can make a final count of how many stem cells your child produce and how many stem cells is going to be infused back in their bodies. And we made a specific lab exam to count the stem cells. The stem cells, the technical term is CD. CD means cluster of differentiation, and the stem cell is the CD34. So we make a final count of this CD34, and at the end of the therapy, or a couple of days later, we are going to give you the final results. And it goes in millions, depends on the weight of your patient, of your son. There are patients that basically our average is around 20 to 40 millions of CD34. It not necessarily means that if you have higher levels, it's going to be more improvements or more gains, but it's more depend on how much the bone marrow react to the stimulation in the first 3 days of the therapy. We also do this study in a different lab to avoid any conflict of interest. And we give you like I told you, the final report, and also like Dr. Guillermo said about the viability of how many stem cells were alive. And that is why the main reason, like he said, about do it in the same day. And the stem cells work in children with autism because have the ability for rapid proliferation and has a specific paracrine effects to secretion of various trophic factors and immunodulatory substance, which makes them a preferred candidate for children with autism. The paracrine effects are releasing bioactive molecules and their ability to quickly traffic to the site of inflammation. There are also specific things that is called homing. Homing is the ability to be in the area where it needed, and the stem cells can do that, can do a specific in the place in the brain that needs to be worked. And that is something that that has been tested in the stem cells that can do that. Also has cell renewal and it improves the pro-inflammatory changes that can be seen in patients with autism, and also can change from a pro-inflammatory state to regulate that situation in children with autism. Release cytokines that are good, and to reduce pro-inflammatory cytokines that can be harmful in the microenvironment of the brain. So basically, that is how the stem cells can be worked, and what has been published of how does it work.
Well, but this is really important. Dr. Anna already told you like the medical way that we can see the changes in the neural system. But how we are going to measure this in the stem cell patient? And this is the most important thing. Here in BIOS, all the patients that arrives with autism, we make a special interview with you as a parents and we as see at the patient just to see the level of autism that the patient has. We run two tests that calls CARS and the other one is IDEA. These tests help us to know the patient's autism level, and then we can see in a follow-up after a month and after 6 months how the patient is doing and how much the patient gets like better or recovers after the therapy. And the important thing of this, for example, here are some graphics of some patients in the last 2 years, around 70 patients we see, and just of these 70 patients, we make a follow-up of around 40 patients. And then we can see them that they were in a higher level of autism and how this stem cell therapy helped them to reduce this level of autism. But maybe you will say, well, yes, this sounds really good, doctor, but tell me more about how I'm going to see my child afterwards. For example, some patient starts to say words or maybe phrases and meaningful phrases. Some other patients with autism starts to have a better eye contact, or maybe they have a start to be more easy to have a, like convivent with other kids, and maybe in the school they can concentrate more or do things that with an instruction, and then they starts to be able to talk or say what they want to do or what they feel. So this is the kind of changes that we already seen in patients, changes really meaningful. For example, I remember some parent that told me, doctor, my kid used to be muted, and after the stem cell therapy, he starts to say, "Mom, I want to go this place. Mom, I want to do this." So these kind of things that really change lives and change families because they are able now to say more about them. And this is the most important thing here in BIOS. We want to be sure that you see your kid better and try to improve the quality of the life, not just from your child's, also from all your family. We want to show you a little bit about our facilities. This is the laboratory that I was talking about before. The laboratory has some equipment especially to reduce any kind of infection, or everything has to be really sterilized and clean. So we really take care of these things. As you see in the pictures, they have this special machine that calls flow cytometry, and also these cabins especially to do not introduce any bacteria. Everything is sterilized inside of it, and we really take care of this kind of places that we work in.
And this laboratory is specific for this stem cell therapy. We don't process anything, just the therapies.
Yeah, that is really important. We really are focusing this. We are specialized in stem cells, and our laboratory only works with stem cells. So what we do is to be the most honest with you in what we do and do it without risk. Other pictures about our facilities, some of the offices, the consultory, also the place that we work, the hospitals and the ORs are really private and private facilities. So we don't work in public hospitals. We don't do it in places that are open to have more patients that we don't want to contaminate our samples. So we try to do the best for you, and that is the most important.
And for example, it is important because we know that you are traveling with your child, so sometimes it can be very stressful to be with more people, and you have a private waiting room until your child gets in both the procedure, the bone marrow activation and the administration of the stem cells. And basically you are with him without there with more patience, and you're really comforting there. You have a TV, you have Wi-Fi, you can get, I don't know, some toys or something to between the two procedures. And that is really important, that you can be comfortable and no more stressful because of this stem cell therapy.
This is our team. We are not just the only ones here. We have a more than that team that you're looking at the picture. Actually, we are more now. and this team is working with you all the time, trying to give you the best things. And we have people focus in your travel, people focus in the medical area, people focus just in the nursery area, people focus in the laboratory. So we are really trying to give you the best and trying to be the complete team for you and your travel. These are some testimonies, and I want you to have a little minute to read about it. Some patients talk about how some parents of the patients talk about how is everything doing with them, and how this therapy changed their lives. Well, we're a global medical clinic because we already have seen patients from Japan, from Australia, from Spain, from United States, from Canada. So all over the world come to Mexico to have this stem cell therapy. So we have the experience to give you the best uh, treatment and the best things in every place. We help you with the hotel. We help you with your transportation. We help you in any way that we can do it to give you the best thing. So now is the moment that you can give all your questions. We want you to try to write all your questions down, and we are going to read it here. So if you can help us with that, it will be wonderful, because we will be able now to read it and try to answer all your questions. Okay, we have a question, and I don't know if you want to answer, Dr. Anna. It says, why we use hematopoietic stem cells and not mesenchymal stem cells like in other clinics? It's really important to say why we prefer these stem cells than other ones.
Here in Mexico, we are secure, and we have to do all about our Ministry of Health. We are everything enrolled. And the bone marrow stem cells are the ones that are approved. The mesenchymals, even that there is a lot of information about it, hasn't been totally proved to be safe, and that can be worked in different diseases and in different patients. Basically, this is why the main reasons that we're working with bone marrow stem cells, and also because we have been working with them almost 10 years, and we are very sure that has a lot of results, and we can have a good final count of CD34, like I told you before. So basically, that is one of the reasons that we prefer to use bone marrow.
Something important, and we want to be really honest in this way. When we use stem cells from the own patient, we are really sure that the patient is getting good stem cells, healthy stem cells, and we can apply it directly to the neural system. Something that you cannot have it if you have umbilical cord blood or mesenchymal stem cells. Because when you have mesenchymal stem cells, umbilical cord blood stem cells, they have to froze these stem cells in a special liquid, and this liquid is toxic to the neural system. So they just can apply it through IV. So we want to be sure that what we are doing can go directly in the place that we want to do it. So that is the neural system, and also to have enough stem cells that Dr. Anna is saying. Something also that the people is asking is, what is the difference between us and other clinics that do the same kind of treatment?
I think that one of the things that I like about BIOS, because we have been told with when our patients leave the clinic, when they finish the treatment, is that we try to be very personalized with the patient. We try, for example, that the date of the therapy is only going to be your person, to avoid any kind of confusion. You have a specific driver to take you to the clinic in case that you are not here from Monterrey. You have a specific person that can be in all of the time since the day one when you ask for information to us, and to the day that you are leaving in the airport. So we try to be very personalized the stem cell therapy. We know that it's a difficult decision to decide to do this stem cell therapy, to have all the information, to make sure that you want to arrive to a different country, to a different language, and we what we want is that you don't have that more problems, that you have to think about other situations, just to be totally focused on your children health. So I think that is really what I like about Bios, that we try to be totally focused in all of the areas. We give you all of the final results, all of the reports that we do here. We make cultures to see that they are not growing any kind of bacteria or infection in the samples, and all that things makes you that you are more secure, that it's not going to be a final problem when after the therapy.
Also, I want to add to this that we make the procedure in private facilities. The private facilities is something really important because we are doing the OR. The OR is just something that the most important thing. We are not in a public hospital or something like that. We try to do it all in a private facility, that everything is clean, that everything is private, that everything is more focusing you, and that everything is completely safe for you, because if we do it in other places, we can have different changes of time because it's an emergency or something that comes up. So we try to improve these kind of things to get a better quality of everything, treatment for you. So that is something that to add. I don't know if you have any other questions. I invite you to write it down, please. And if you don't have it, we can also tell you something important. That if you have any questions afterwards of this webinar, you can try to contact us in this telephone or email, just to answer all your questions. We're going to give you, all your answer you, or try to contact you as soon as possible to be really specified with all that you're asking about.
Okay, how many days you have to be here in Mexico? Specifically the therapy, it takes 4 days. That is the 3 days of stimulation and the date of the procedure per se. We would like if you can be 2 days more after the stem cell therapy, because we can be more to see how your child is reacting to the stem cell therapy. They can be symptoms after the procedure. It can so we can be monitor them, and it's easy for us. And in case that something came up, we can work right away. There are specific cases in when you are the patient, for example, or the patient or the family is a little concerned about pain or something like that. And in case that it has to, we can go to your hotel to check your patient in case that is necessary. Or if something came up and needs another kind of attention, we can also do that. So because we are qualified and we are certified here in the medical area from Mexico. So basically, to be totally sure, that's the reason why we told you you can be here. If you can 2 days, that will be awesome, but it's not like 24 hours after the therapy to see that everything is okay. And more if you are if you have to take a plane to see that everything is okay before you leave the city.
They're also asking if the treatment includes a place to stay. Yes, we can include it. It's a special offer that we are having in this moment. It's going to be in a department, and we can give you 7 nights in a department for you to stay there. So we can also include it in our prices. So yes, you can ask about the prices and all these things, and the number or in the email that is in the screen.
Well, right now we're going to put a special video of one of the patients or the families that have been here with us actually 2 times. And this is the story of Noah. It takes on like 4 minutes video. So in case that you want to ask anything else, you can put it
In the
you can
chat.
text it in the chat. And while we're going to watch the video.
Hola, somos Cristina
y David.
Venimos de España. Estamos aquí porque nuestro hijo Noah, de 6 años, tiene autismo y bueno, descubrimos su condición alrededor de los 2 años y empezamos nuestro camino de buscar terapias, tratamientos que pudieran mejorar su calidad de vida, su estado, y entonces, descubrí los tratamientos de células madre, empecemos a investigar el tema, nos decidimos por un tratamiento autólogo, queríamos que fueran sus propias células, y entonces apareció BIOS en nuestro camino. Lo conocimos también a través de las redes sociales, grupos de Facebook, de otras familias que habían estado aquí. Y entonces me puse en contacto con BIOS, con el centro. Enseguida estuvimos muy atendidos, resolvieron todas nuestras dudas. La verdad es que tenía muchas, escribía muchos mensajes, muchos WhatsApp y siempre me contestaban todo, estaban siempre ahí. Y al final, pues nos decidimos por venir, aunque el viaje es largo, pero al final decidimos venir, que no es fácil con un chico con autismo hacer 12 horas de avión, escalas, pero al final todo fue bien. Y llegamos aquí y la verdad que el trato fue una maravilla, nos trataron muy bien, me dio mucha seguridad, tenía muchísimo miedo, pero fue llegar aquí y desde el primer día se me fue el miedo, me quedé muy tranquila. Me dieron muchísima tranquilidad, el doctor, todos, desde recepción, doctores, el personal, el día de la intervención, en el centro, en el quirófano, todo el personal muy atento, La verdad es que no puedo decir nada malo, al contrario, de todo el proceso del tratamiento, que es una semana, y al final todo salió bien, regresamos a casa bien y nada, a esperar un poco a ver qué pasaba, ¿no? Tardó un poquito, a partir de más o menos alrededor de los 3 meses, no había pasado aparentemente nada nuevo y de pronto empezó a cambiar mucho, ¿no? Si quieres contar un poco.
Bueno, él no ha mejorado
en
montón,
todo, a nivel de lenguaje, a nivel cognitivo, comprensión.
Comportamiento, porque estaba bastante desconectado y a partir de hacer tratamiento se estaba conectar mucho más con el mundo.
Con sus propios hermanos, que no jugaba apenas, sí. Iba todo el tiempo detrás de ellos, intentando ver qué pasa, si podía jugar con ellos. Después también en la escuela y en los centros de terapia donde él asistía de antes de venir a BIOS, pues ellos no sabían de nuestro viaje a BIOS, queríamos que fuera algo objetivo, si ellos veían algo, queríamos saber si realmente ellos veían algo sin estar influenciados por nosotros decirles, mira, hemos hecho un tratamiento y el niño va a mejorar mucho o no. Y fue sorprendente como todos decían, pues, ¿cómo está Noah, no? De repente, que lo que no habíamos conseguido en muchos meses, los hitos y las metas que nos vamos proponiendo, las vamos consiguiendo. En la escuela también decían que nunca habían visto en un alumno de necesidades especiales un cambio tan rápido a nivel cognitivo, a nivel de comprensión, de relación con los compañeros del colegio. Y ahí nos dimos cuenta que habíamos hecho muy bien.
Que hemos acertado.
Habíamos acertado y de hecho, pues...
Porque también hay que decir que antes hemos probado muchas cosas y no nos funcionaba muy bien. Pues el tratamiento de células madres aquí en BIOS nos fue genial.
Sí, o sea, antes las terapias, todo funcionaba, sí, mejoraba en algunos aspectos, pero tardábamos mucho en conseguir un solo pasito.
Sí.
Y después de hacer el tratamiento era como que él a nivel neurológico estaba como más despierto, más preparado y ya todo lo que se le daba lo aprendía más rápido, ¿no? Era como que servía de algo. Todas las terapias del lenguaje que se hacían, hasta las que se habían hecho hasta el momento, no habían conseguido arrancar el lenguaje o la comprensión. Y seguimos con las mismas terapias, incluso añadimos alguna más, pero fue después de este cambio cuando empezó a aprender lo que se le llevaba enseñando ya 2 o 3 años. Parecía que no hacía, sí,
estaba completamente bloqueado.
Sí, que no se plantaba ahí la semilla, nada daba frutos, ¿no? Y entonces, a partir de ahí, esas mismas terapias que se le daban de antes, pues fueron dando todos los resultados. Y la verdad que, bueno, queremos más y sabemos que esto no es una carrera de fondo, que es una maratón, hay que ir poco a poco y seguir. El tratamiento fue hace un año, justo, las mismas fechas prácticamente, y bueno, hemos decidido volver a repetir porque ha sido el mejor tratamiento que hemos hecho hasta ahora en relación con su condición y con Noah.
Sí, ya tenemos muchas ganas para ver qué va a pasar después de ese tratamiento que vamos a hacer
Sí,
ahora.